health scare for former U.S. President Bill Clinton. The UN Special Envoy to Haiti is in hospital, this after undergoing a heart procedure. Clinton's doctors inserted 2 stents to open one of his coronary arteries. He does have a history of heart problems. In 2004, Clinton underwent quadruple bypass heart surgery. The next year, doctors removed scar tissue and fluid that had built up following that surgery. Well, a counselor to the former president says Bill Clinton was admitted to the Columbia campus of New York Presbyterian Hospital. This after feeling discomfort in his chest. He says President Clinton is in good spirits and will continue to focus on the work of his foundation and Haiti's relief and long-term recovery efforts. So why don't we take a closer look at the kind of procedure that President Clinton underwent. Dr. Hina Chaudhry can help us with that. She's a cardiologist who joins us from New York. Okay, so what we know is he had some discomfort and he had these 2 stents. That was part of the procedure. What would that suggest is going on here?
Well, one has to understand that coronary artery disease is not a disease that's limited just to the coronary arteries. It's a systemic disease that's present throughout the body. So if you fix blockages at one point, they're still going to come back, especially if you don't take care of the underlying disease in a very aggressive manner, for instance, by diet modification and exercise and quitting smoking and limiting other such risk factors. And therefore, once you undergo surgery, that doesn't mean that you're not going to be prone to future blockages in your native arteries, or in addition to the arteries, to the new grafts that are put in at the time of surgery. They can also develop disease some years after the initial surgery.
Dr. Chaudhry, you know, one of the things we all know about President Clinton is he's a very active man. He's always traveling internationally, but obviously that puts some physical stress on a person. Could that sort of lifestyle contribute to ongoing heart problems like this?
Oh, very definitely. He does live a very stressful lifestyle, and that's sure to be a factor. He underwent bypass surgery about 6 years ago, and even when doctors do place grafts into the heart, the natural lifetime of those grafts is limited to about 10 years. So after 10 years, the patient usually needs a reoperation anyway, but given President Clinton's lifestyle, that process was probably accelerated to some extent.
Let's just talk about that surgery that he had back in 2004, and actually he's been admitted to the same hospital where he had that work done. After that sort of surgery, aren't you on constant medication every day once you've had that kind of damage to your heart muscle?
Oh, definitely. There's certain medications you have to be on every day for the rest of your life because, as I said, it's a systemic disease, which means it affects the entire body, and it doesn't just go away with surgery. You have to keep treating the underlying factors. So we give aspirin to such patients, which they have to take every day for the rest of their life, because that limits the possibility of blood clots in the coronary arteries. There are other medications as well that are given to control the heart rate, such as beta blockers, so that when a person does undergo stress, their heart rate cannot go too high, because that places an undue amount of stress on the heart. So definitely medications are needed every day for the remainder of a patient's life.
Now, reportedly, he didn't have to have a general anesthetic or anything like that. So does that suggest that this wasn't a particularly serious procedure? I know it's really difficult to say in these circumstances.
Well, this procedure was not surgery where you actually have to open the chest. This is what we call an interventional procedure, and it's done through the groin, and catheters are threaded through the femoral artery. So all you have to do is make a small puncture in the groin and thread a catheter through the femoral artery up into the aorta, and from the aorta we are able to access the coronary arteries, and through those catheters, stents are placed inside the coronary arteries to reopen those blockages.
Okay, Dr. Hina Chaudhry, thanks very much for filling us in on the technicalities of this procedure that President Clinton's undergoing at the hospital in New York. Thank you again.
You're very welcome.